Scoliosis. Let's talk about it in this particular video. What does it mean? What does scoliosis mean? Scoliosis basically means S curvature or C curvature of the spine. That's when tracking the person's back. The person has an S shaped or a C shape, and it can be painful sometimes when the person is just trying to sleep. It can also affect the person's breathing and cause stress issues for some patients as well. So how can you know the type of scoliosis that you have? In some cases, it's not always as obvious as in others. Some people's zone might not be as obvious. Some people you might see like this. Some people's zone might not have that look where their shoulders are tilting. Some people can very mild. It all depends on the type of scoliosis. We have the functional scoliosis and the structural scoliosis. The functional one is as a result of when someone sit in a wrong position for a period of time, wrong posture, weak muscles, for example, as well as also wrong posture as well. And what can the person do? Basically, we address where you sit down to realign your spine when you notice a particular thing. But that case is actually the fact that they had an accident and then the limbs are now unequal. It's still a result of something that led to that particular condition. So what can you do also? You can, for that person that has limb length discrepancy, you can actually let the person use a shoelace. You have to balance the back and then the person is fine. And the second one is as a result of, it's called structural scoliosis from birth. It could be as a result of a disease or something that affects the person, and then the spine comes like this. So it all depends, and it all depends on what could have led to the injury or the accident. Now, what should you do for the person that also has structural? For this particular person, the person might need to go for a surgery or use braces to correct, because at that time the curve may be so bad and the person literally having it obvious when he or she is dressing. So you can notice this when the person actually has his or her shoulder higher, or the hip on his higher than the other. So it all depends on presentation of the particular person. And this functional scoliosis, a lot of people actually come down with this consciously or unconsciously, because in a way we stand now like this. So you put your particular angle like, so you're resting like for a long period of time. So I do it occasionally, recently, every single day, at work, at home, anytime you're doing something, your body feels like this. So you're literally working the muscles here and then strengthening this one. You might have scoliosis, it all depends. But one way you can know the scoliosis is structural or functional is if you tell the person to bend forward. If the person bends forward, the so-called S or C curve that you see when the person is standing upright will no longer be there again. But if the person bends forward and the curve is still there, that means it's more of a structural one than a functional one. So those are the two ways you can know whether your scoliosis is structural or functional. And that will be all for this video. Don't forget to like, don't forget to comment, don't forget to share. And until next time, see you.